Hi everybody, welcome back to the channel. Today, I want to ask you something. Can the Ontario government really provide equal quality health care to long-term care patients by doing two completely opposite things at the same time? So last week, I got an email about a new program called High Intensity Supports at Home, or HISH, H-I-S-H. On paper, it sounds great. Get more help at home for people waiting for long-term care. One team coordinating everything. That would be nursing, rehabs, personal support, respite, and system navigation. That's one. Now, at the same time, the government is also testing another program. Here comes some more initials. CALTC. That is a 2-year, $15 million test program. And that tries to move seniors out of long-term care and keep them at home with institution-level supports. The Ford government is also investing $180 million to recruit and retain 8,000 nurses for long-term care homes, showing that they are not abandoning institutional care but are trying to balance both systems. So, are we supporting long-term care or quietly shifting away from it? As somebody who lives with a disability and watches these systems very closely, I want to walk you through what these programs actually mean for disabled people, seniors, and families trying to keep loved ones safe. So let's break this down in plain language. As I said, on paper, HISH sounds great. Integrated team-based care, enhanced personal support, and comprehensive navigation. But what I hear under all of that is very sick, very vulnerable people waiting for long-term care, being told, you can just stay home a little bit longer and we'll send more help. There are currently over 500,000 people living with dementia and less than 300 dementia care specialists in Canada. The number of people with these diseases is expected to grow to nearly 1 million by 2033. As of 2022, about 20% of Ontarians have severe disabilities. Mental health-related disabilities have increased by about 6% since 2017. Now, you have the same sort of situation with community access to long-term care, the pilot program. Services such as they'll provide you are personal care, meal preparation, that among others, and the government talks about choice and dignity, and that's important. Okay, my question is, with who? We already don't have enough PSWs, nurses, or rehab staff. So where are all these extra people suddenly coming from? If you strip away all of the buzzwords, it's also about freeing up beds and managing a crisis system on the backs of families, mostly women. Often they are disabled or aging themselves. And that's not choice if the support isn't actually there. So when I read the HISH paper, the program notes, I immediately thought of my own family's experience. And from about 2009 to 2014, my mom and I cared for my dad at home in Northern Ontario, after he was diagnosed with Alzheimer's, and we had to rely on the home care system as it was then. And even back then, there weren't enough staff. Services were limited, visits were short, and living in the north meant long distances and fewer workers to begin with. When my dad was bedridden and getting bed sores, my mom and I were turning him 4 to 5 times a day on top of when the PSWs could come. And one day, they brought an air bed to stop the pressure points. They sent one PSW and the delivery guys, and nobody knew how to set the thing up. So here's this one PSW literally holding my dad in her arms while the others are on the phone with the manufacturer trying to figure out how to inflate the bed. That is what care looked like for us. So when I hear the government promising more support at home, I don't automatically celebrate. I have questions. What has actually changed? Do we now have enough trained people to deliver all these services consistently, especially outside big cities? So let me read you a chunk of the email that I got about this new program. And as I read, I want you to listen for who's being centered. Is it people or is it the system? Ontario Health at Home is launching a significantly enhanced home care program to address the needs of currently hospitalized individuals with severe dementia and mobility limitations requiring extensive care and supervision. Significantly enhanced. Compared to what? Because what that sentence quietly admits is that up until now, people with severe dementia and major mobility limitations have not been properly supported at home. These are real humans, not system flow problems. They're talking like they just discovered they exist. This signals a first in Ontario's home care program in addressing the needs of individuals who need significant complex care support at home. A first. So you're telling me that in 2025, this is the first time Ontario's home care system is even trying to seriously support people with high complex needs at home. This doesn't make me feel hopeful. This tells me how neglected these people and their families have been for decades. Those requiring 2 people to lift them and who need constant supervision and 24-hour support will now receive it through Ontario Health at Home. Will now receive it. As if that's a small tweak. Families have been lifting, turning, toileting, supervising their loved ones 24/7 for years with no pay, no backup, and often wrecking their own health in the process. This isn't a shiny new benefit. This is the system finally noticing the unpaid labor it's been quietly stealing from caregivers. Almost 600 individuals will be served initially at a price tag of $11.4 million per month. Flat fees will be paid to providers at rates of $5,000 per week for individuals with significant medical and personal care needs, and $1,500 per week for individuals requiring mental health and addictions support services. Let's sit with that. $5,000 a week. That's about $20,000 a month per person for complex care. Ask any family caregiver how much they're getting for doing this work. Yep, nothing. And the mental health and addictions piece? $1,500 a week in flat fees. Like, You can put a flat, fixed price on people in deep distress. There's something rather cold about turning human beings into billing categories. Registered nurses will manage teams of personal support workers, physiotherapists, and occupational therapists. It sounds great on paper. But again, with who? We already have PSW shortages. We already have nursing shortages. We already have burnout. Are they actually hiring and training new people, or just stretching the same exhausted workforce thinner and calling it enhanced? This program will target the areas with the highest numbers of alternate level care patients currently in hospitals in the Toronto Central and Mississauga-Halton regions and in parts of Central Eastern and Northern Ontario. So, they know exactly where the crisis is. Alternate level care patients stuck in hospitals because there's nowhere appropriate to go. But instead of asking, why is the system failing them? The focus is, how do we move them out faster? Again, people are being treated like bed blockers, not like seniors, disabled people, and families who deserve stable, dignified care. For many of us, this email is a perfect example of how policy can sound compassionate while still trivializing the people at the center of it. If you've lived this as a disabled person, as a caregiver, as a senior, you're able to read between the lines pretty quickly. And the question I keep coming back to is, are we building a system for people, or are we just managing a crisis for beds? So where does that leave us? If you're watching this and thinking, it sounds like my mom, my partner, my neighbor, or me, I want you to do 3 things. First, tell your story. In the comments, write the one thing you've lived in this system as a senior, as a disabled person, as a caregiver, as staff even. You don't have to share names or details if you don't want to, but our government counts beds and dollars, and we need to make sure they can't ignore the people behind those numbers. Second, if you're in Ontario, take 5 minutes after this video and email or call your MPP. Ask them a very simple question. How will you make sure high-intensity supports at home actually protects disabled people, seniors, and caregivers, and doesn't just clear hospital beds? You don't have to make a speech. You can literally copy and paste the question and send it. Third, if you found this breakdown helpful, please share this video with one person who needs it. A friend in the system, a caregiver, a worker, or the one policy nerd in your life. I'm a disabled advocate trying to make sense of messy policy from the perspective of lived experience. If you want more of this, more plain language breakdowns of what's happening in healthcare, long-term care, and disability policy, hit subscribe and turn on notifications so you can see the next one. Because these decisions are being made either way. The question is, will they be made about us or with us?